site was definitely around 24 hours ago. Currently, the location of the infected individual is currently unknown. Doing a full assessment. First we must assess the airway. So, hello? Hello? Can you tell me your name? Ollie. And do you know where you are? Airway. Can you please do a brief auscultation for me?
Sure thing.
Oxygen levels currently at 89%, which is a little bit low. We currently have a respiration rate of 20, which is slightly above what we would want to see.
Sounds
So
like
there's
it's entry both sides.
equal air entry on both sides.
Let's get an upstate connection.
ECCO2 level is 7.4, which would signify that there is a small amount of respiratory failure starting to develop. We've sent blood and sputum samples over to the lab. Can we get the report, please?
Yes. There seems to be minimal conidia transmission throughout the bloodstream. Those are spores. It seems to be limited to the area around the bite, so there seems to be some grouping around the heart, potentially the lungs.
Thank you for that. So currently the BMs for blood glucose currently show 5.1, which again is within normal parameters.
Fully reactive, both sides, back fives.
Okay, so that is again within normal, perhaps maybe slightly elevated from what we want. Infected individuals are known to have some susceptibility to noise, which is shown in this regard here as well. Wound is currently oozing, leaking. We've dressed the wound and hopefully to stop it. Anything from the lab that we would require?
I'll be interested to have a note taken of any behavioural differences they exhibit in the following weeks or days. Potential issues may arise if they seek out places of high elevation and shun social contact, that sort of thing. All of those seem to be signs so far of progressing infection.
So what we will look for some treatments with may include adrenaline as well as antifungals. The problem we're currently facing is obtaining antifungals. Sign our patient to a bed and view as soon as we can. Okay, second patient is 22-year-old female, brought in a number of weeks ago with varying degrees of aggression and had to be sedated quite drastically. In the latest attack, they were forced to commit a lot of cranial trauma by the security team. Current ECG shows a systole. Oxygen saturations are non-existent. No BP is found.
We're looking at the control now.
Very well. We'll send it to send her to control. Number 3. So this is a patient who was a 26-year-old patient who was brought in. Flight was roughly around 12 months ago. This patient has shown extreme aggression as well as a certain amount of cunning thinking. At present, this patient is sedated with 5 milligrams of dazolam and a hourly infusion rate of 1.2 milligrams of remifentanil. This has kept this patient relatively sedated, though a extreme amount of movement or infection does tend to manifest in them. Looking at them, they're currently maintaining their own airway, though an NP airway has been put in as well, just to make sure that their airway is sufficient. Currently, this patient is not able to communicate in any way, shape or form with us. Any attempts to communicate with them just result in more restrictions. Oxygen saturations are 77%, which indicates a severe pathology, as well as an ET-CO2 carbon dioxide level of 12.3. This shows a patient who is in type 2 respiratory failure. However, the patient does not appear to be affected by this at all. There are signs around the cyanosed fingertips as well as the cyanosed lips of a lack of oxygen. However, as previously located in the lab result, this does appear to be prioritised for the fungi and the organs as opposed to anything else.
The hyphal structures that have infiltrated the body and the musculature are utilising all of the respiratory functions of the body, and that's why the Larp doesn't require much oxygen at this point. That thing is more fungus than human at this point. It'll be interesting to see whether the brain is still functioning.
In individuals known as clickers, then they have a high viscosity of blood. Would you be able to explain that for us as well, please?
As the body, as the fungus ceases to require the oxygen within the blood, it will begin to sap all nutrients it can, or the carbon from the body, and that can lead to the blood vessels becoming coagulated and blood flow being slowed. That could also be in part a contributing factor to the resistance to physical trauma that these clickers.
So this is potentially one stage before clicker, if there is such a thing. The BP is 212 over 123. This shows a severe hypertension. ECG shows it did show a severe amount of enlargement of the heart, as well as a number of likely reduced air entry in line with the cordyceps infection.
Unequal on that one.
So unequal. So previously the pool showed a 7 and a 5 were both known to be sluggish. The difference is likely from the pressure resulting from the cordyceps infection inside the brain, something like that, and having an effect. Again, this could be also linked with the fact that our patients cannot communicate with each other, or whether this is down to part of the infection. So looking at them, we've got a number of different fungi that are starting to bloom on them, as noted by our physician as well, our scientists as well. This does appear to be prioritised by our things, which has resulted in the cyanosis. Temperature is in line with what we'd expect with a human, so 36.2. Whether this is due to the infection, bring it up, because I would expect the temperature to have dropped quite drastically. Whether this is what cordyceps requires from its hosts, this is what it has resulted in. Blood sugar is unfortunately unreadable, as the pancreas now has ceased to function. It shows no evidence from our patient to be affecting them in any way. And finally, it appears that the echolocation is increased with the resistance to sound considerably heightened in these particular patients. So we will move on to our next one.